Hello friends, this is Dr. Kapil Sharma, a practicing homeopath in Ludhiana. Because of repeated requests from my patients, today I am going to share you some of my knowledge on coronavirus infection. So, what is coronavirus infection? It is a viral infection that is just like common cold and flu, but the difference is that it is highly infectious and it can cause serious complications in 10 to 20% of the cases. So, here the important point to discuss is that it is self-limiting. In 80 to 90% of the cases, it is a self-limiting illness. That is, it completes its course of 2 weeks, after which the body develops its own immunity and kills the virus. In rest of 10 to 20% of the patients, it may go serious, but it most likely happens in patients who are either elderly, immunocompromised, or suffering from other comorbidities like diabetes, hypertension, asthma, etc. The purpose of making my video is not making you fear of this coronavirus, but on the other hand, making you aware of all the complications and how to deal with coronavirus infection. Friends, if you say a patient, how can we diagnose anybody who is suffering from coronavirus? As I sit in my OPD, I see a lot of patients. Mostly the patient comes with history of high-grade fever, body aches, loss of appetite, nasal congestion, cough, difficulty in breathing, loss of taste and smell, and in usually either we can say commonly diarrhea also happens in these days. Out of all these 5, 6, 7 symptoms, if anybody is having at least 3 symptoms, he must go for RT-PCR test without any hesitation, because it is the only test as recommended by WHO which is highly effective in finding out whether the patient is suffering from coronavirus infection. So, other tests are also available like HRCT, but I would suggest HRCT is usually not an test which describes this infection, because it only indicates infection in the chest. That happens only when the virus reaches the chest. So it is advisable to go for HRCT after 5 to 7 days of infection. Before